Not being able to see your dentist during the pandemic time can be really concerning, which is why I made this little video on how to minimize your need for seeing a dentist and how to maintain your teeth at its best while you don't have access to a dentist. Okay, it goes without saying that you need to brush and floss. Brush 2 or 3 times a day or after every meal. Floss once a day at bedtime before you go to bed. I want to talk about toothbrushing first. If you have an electric toothbrush, Sonicare is the best one, but if you have any other kind, that's fine. Just make sure the tip is new. So you don't want a tip that's more than 3 months old and all disassembled and whatnot. Keep it clean, make sure there's a little bacteria or buildup on it. If you have a manual toothbrush, there's nothing wrong with it. Just make sure it's also new, so not more than 3 months old. The bristles need to look good. And buy a soft toothbrush, okay, soft. Toothpaste, it doesn't matter as long as you like your toothpaste, it's fine. I just don't care for toothpaste that don't have fluoride. So right now you can't really see the dentist. You need fluoride, okay? As far as flossing, so you've all heard floss daily, floss daily. Okay, these things, these wishbone things that hold a floss in between, they're not really flossing. They're better than nothing. Sometimes they get little food particles out. So unless you have arthritis or issues using your fingers or manual dexterity issues, whatever, just no. This is a no. What I like is like regular floss, preferably waxed. And one of my favorite brands is Coco Floss. So Coco Floss is sold on cocofloss.com or they sell it at Target. And if you don't have access to Coco Floss, there's another one I really like at Whole Foods. It's called Smart Floss. Smart. And you can go on YouTube and find all sorts of videos on how to floss. So just try to floss appropriately. Now, if your floss gets stuck a little bit, don't get in war with it. So just gently tease it out, and then you can do something like a glide floss, which is not good for regular daily flossing, but it's good to go chase after things. Let's talk about mouth rinses. So I don't really feel it's that important or essential part of your oral hygiene. It has artificial coloring and flavoring, and most of them have alcohol. It's not necessary. In some cases, we actually prescribe them on case-to-case basis. But if you just love it and you just love that scent or it gives you this fabulous fresh feeling, go ahead. But I don't really feel it's necessary. Most of us are trying to have a really healthy immune system, and so we're supplementing on vitamin C. But you want to be careful when you're doing lemon water that you have all the lemon you want, suck it up with a straw or drink it all at once, then drink normal water, just regular filtered water. And don't become one of those people who walk around all day with some sort of acidic drink sipping on it, because that way you're bathing your mouth in acidity all day. So if you're having mangoes and kiwis and strawberries and lemon and salads and this and that, which are all really wonderful and healthy, you just want to remember to rinse with water afterwards, and about half an hour later, if you can, try to brush it. Another way that a lot of people are trying to enhance their immunity is they're taking supplements, which is fine, but please take supplements that you swallow, like a vitamin C tablet. You just take it and you swallow it, versus airborne, which basically makes the whole drink that it's going to take you a while to drink very acidic, and it's sitting on your teeth. And worse than that, I feel, is the gummy supplements. So gummy vitamins, they're very sticky. They can stick to your teeth, to your fillings, to your crowns, and things will fall off when you don't want them to. I think it goes without saying to take it easy on sugar, but the worst kind of sugar is soda, because it has sugar, and anytime you have a carbonated any drinks, like even San Pellegrino water, anything, if it's carbonated, it's acidic. So you have acidity and sugar in a lot of sodas. So just no soda, drink water. And y'all know about chocolate and candy, especially hard candy. Those are really bad. And if you absolutely have to have a hard candy, suck on it and don't bite into it. So biting into hard, chewy things, I mean, do I really need to talk about not chewing on ice? I think y'all know that. You don't have access to dentists. So this is definitely when you want to lose this habit. And then anything really hard and sticky, like nutrition bars, a lot of them are really sticky and hard. Or one of the worst ones I've seen is beef jerkies or dried cured meats. You know, they could just break things off. I don't have any popcorn to show you, but that's got to be the #1 emergency reason people come to our office. Either I bit into an unpopped kernel or the little skin got stuck under my gum or whatnot. Just don't eat popcorn. I know we're all doing Netflix parties and watching movies and whatnot. Don't eat popcorn, please. Just don't.